Hello everyone, welcome back. Glad to see you. Hopefully you've been having a great week. So I'm here doing my first ever Get Ready With Me and chatting. And the topic I put was nurse's notes. I am a nurse, registered nurse, and I have been a nurse for 31 years. 31 years. And first, I want to give you a disclaimer. The information I'm going to give you is my experience, my opinions. You should always check with your doctor before trying anything new as in diet, exercise, supplements. Always a good idea to check with your doctor on things. But I'm just going to give you kind of the basics of, trying to be healthy. And while I do that, I'm going to get my makeup on because as you can see, I got no makeup on. And I have my moisturizer on, already did my skincare. So we'll go straight into primer. Sorry about that, I had a little tickle in my throat. So we'll start with the primer. I'm using Laura Mercier's moisturizing primer for this. I really like it because I do have dry skin, actually kind of normal to dry, but especially during these cold winter times, I'm dry. So just going to use this hydrating primer. I found that it works really well for me. So there we go. And then of course, foundation. So the first topic I wanted to talk about with nurses' notes is hygiene. I apologize for looking down. I have a mirror down here to help me out. So now you've been hearing a lot more about it with the coronavirus. I know. But it has been in place for, I can't even tell you how many hundreds of years. The biggest way to prevent disease, infection type things, is hand washing. So please be washing your hands. We should all be doing that all the time. And if you haven't recently washed your hands, which I do anytime I'm going to be doing my makeup, touching my face, don't touch your face. If you've just washed your hands and want to touch your face, of course, because your hands should be clean then. So before you do your makeup, wash your hands. Always a good thing to do, coronavirus or no. And I know there's been a lot of talk about the hand sanitizers and everybody's running out, and really just a plain old bar of soap and water is fine. Just wash your hands. So that's a big hygiene thing. And then with us who love makeup, the other thing is, I need to build up around my redness here, is our beauty tools. So if you, like me, have been using the Tati Blendiful, which is what this is, that needs to be washed. And I will wash it. I actually ended up, because I'm kind of lazy about washing sometimes. So what I did is I ended up buying 3 of these. And you can use both sides. So like one day you can use one side and then the next day flip it to the other side and use it. As you can see, that's kind of what I've done. Um, and then you need to wash it. You can wash it with just plain old soap, which Tati says is the best. I've actually found what works really good and gets all the makeup out of it is Dawn, just the blue Dawn soap. So when my sponges and everything that I use, as far as that, sponges, the Blendiful, are dirty, I take them down to the kitchen and I get the Dawn soap out and I wash them all up, and then I just set them out on a towel on my kitchen counter and let them dry. And so that's what I do with my Blendiful and my sponges. What I do with my brushes is every day after I'm done with my brushes, I clean them. This is my favorite, but there's other ones out there. This is the Brush Bath by It Cosmetics. So I use that every day cleaning up my brushes. And then I'd say maybe every couple of weeks or so, I will actually do like a bath with them. Let's see if I can get the glare off. This is the Sigma, they call it Scrub, Sigma Magic. And it has little suction cups, so you can put it along your sink. Uh-oh, now I can't open it. That figures, huh? I want to show it to you and I can't open it. There we go. So on the inside, that white part that you see is actually a brush soap. So when it gets wet, it gets kind of foamy and stuff. And it has little bristles here. They're very soft, but they're still bristly so that they can get in to those brushes real well. And you just swirl your brush around that once it's wet and then rinse it off, and then your brushes will need to dry. So do it on a weekend is what I usually do, because sometimes on the weekend I don't wear makeup at all, so I can let them, or I do them in stages where I'll do some of my brushes a brush bath and then the other ones wait, and then vice versa. So that's what I do. So there you have it with that. Because we want all of our tools to be perfectly clean when we're using them. So hand washing, tools clean. Always when you're cooking, be washing your hands, cleaning your counters. So you're getting rid of any kind of germ type things. It's just basic common sense. But I know that everybody's been going kind of crazy looking for the hand sanitizers with the coronavirus around. And it's been driving me crazy when you can just use plain old soap. So please, as long as you're washing your hands, and the ideal to really disinfect your hands is to wash them for a good 2 minutes. So if you think you've touched something really nasty, a good 2 minutes. Otherwise, what I normally do, just for like normal everyday, is I hum Happy Birthday song while I'm washing my hands. And that's pretty good wash time too. And so next on my list was seeing a doctor. Especially at our age, over 50, we should be having a primary care physician looking out after us. I know that's not always possible because of financial reasons, um, which someday I hope they figure out a way to make sure that everybody can get primary health care. Because in my opinion, preventative medicine is the best medicine. And in the long run, the cheapest. And I'll explain why. If people follow up with a primary care physician who's going to look for things that can be treated easily, blood pressure, diabetes, things like that, it will cut down on ER visits and hospitalizations. And why is that? It's because the patient's getting the preventative care to catastrophic events like heart attacks, stroke, diabetic crises, things like that. So in the long run, it's much cheaper for us to, as a community, as a nation, to pay for people to have good quality primary care, preventative care, so that people don't end up in the hospital with, let's say, a stroke. So then they're in intensive care and receiving all of this very expensive medical intervention, not only the fact that they've suffered a stroke, and then they have to go through rehab. And hopefully they haven't lost some of their functions. Hopefully they don't have permanent, one-sided weakness or speech problems, things like that. And so if you can prevent a stroke from actually happening, you avoid all of that horrible stuff. Like I said in the beginning, this is my opinion, but I really do think that that's important. So if you are able to, I highly recommend that you see your primary care physician once a year, unless he or she says you need to come more often than that because of whatever problems they find. So, once a year, and they're going to figure out if you have high blood pressure. If so, they're going to treat you for that. If you're diabetic, hopefully they detect it when it's in early stages and is a type 2, and you can try and control it with diet control and exercise, and you won't have to worry about medications. Otherwise, they can put you on the necessary medications to keep you well. Hang on just a minute, I need a water break. For some reason, I am so dry today. So I highly recommend a doctor. Also, a dentist. And then the thing with dental is, obviously, we should be going every 6 months for our dental checkups. And there's a strong correlation between oral health and cardiovascular health. Because your mouth can be kind of the germiest part of you, and if you have a lot of decay, if you have some gum disease or whatever, all of that can be managed if you go to regular dental visits. And I know people aren't crazy about seeing the dentist. I have to admit that I always had a phobia of dentists because I had a bad experience as a child. So I get it, but it is still an important thing for your overall health, not only your dental health, but your overall health. Now, the nice thing that I've learned, actually from my own dentist, is that if you live anywhere near a dental college, they have free clinics. So if you have any kind of financial concerns, especially with dental, because some people don't get dental insurance, try that. See if you can find a clinic near you. So that's that about that. Let's see, my notes are on my other side of my tati. Oh yeah. So, I know this is gonna kind of sound weird coming from me because I am overweight and I realize that. And so, where was I going with this? Like anybody, you know the saying, it's easier to know what you need to do or should do than to do it. But I am trying, and that's the important thing, is that you're constantly trying. And I have to admit, I did a few years ago come close to becoming type 2 diabetic. And I altered my eating, and I was exercising. And that was all, the exercise also was because of, I needed a knee replacement. I have a history of spine surgery, so I need to keep my spine strong. So I've always exercised, but I have to say, when my knees started bothering me a whole lot, I kind of ramped up the exercise some more, just because you need, if you have any kind of joint problems, you need your muscles around that joint to be strong to help support it, and it does help with pain. Because if you have a wobbly joint, it's going to be more painful. So, when my knee first started getting bad, I joined, and this is a few years ago. I'm trying to think how long it's been now that I've been in this class. I've been taking a water, like, I guess you call it water aerobics, but it's water exercise for arthritis. And I saw a huge difference when I started that. That helped a whole lot. So any kind of exercise though that you can get, I mean, if you can go to a gym, that's great. If you can get a trainer to get a good program going for you. Another thing that's important for women as we get older is to be doing some strength training that helps protect and strengthen your bones. So that is another thing that I would recommend. Anyway, so what I do, and I have to admit, over the holidays I kind of fell off the wagon a little bit. But my normal routine before I fell off the wagon was my class, my water aerobics class or whatever, is twice a week. So I would go to that. And then 1 or 2 days a week, I would do a strength training routine. And actually, my son is studying to be a physical therapist. And so he got me started with a strength training program. And then something I want to mention that, you know, it was he that said this first. Motion is lotion. So the more you can move and exercise, the better you're going to feel. Joints don't like to be static. they stiffen up, they become painful, and we don't want that. We want them to be nice and mobile. So, motion is lotion, is what my son says. So yeah, now I've been kind of lazy about my strengthening, unfortunately. So I need to get back on the bandwagon with that. And let's see. Oh, that's not the one I wanted. All right. So yeah, exercise can be anything though. If you like to walk, the nicer weather is going to be coming out. That'll make it easier as far as walking. And if you haven't exercised at all in a very long time, go see your doctor, make sure it's okay. And just start out slow. And that can be just walking to your mailbox or walking to the end of the block and back, and just gradually increasing, making that walk a little bit longer each day. I have to say though, my favorite exercise is the water exercise. Just because it doesn't put a lot of stress on my joints. Since I'm overweight, I think about that. And it's looking pretty good, huh? So I think about that. And the instructor I have is so good. She really works us out. I'm probably the youngest one in there. Well, maybe there's one close to my age, but in my class. So, but that's okay. Exercise is exercise. Who cares who's in the pool or doing it with you, right? And as far as diet, there's all sorts of crazy diets out there, but I have to say that, you know, the slowest I know, which is hard because it is slow. You can see slow progress with those, is just the normal watch your proportions. And there's all sorts of information out there about proportions. So you can research that. But watching your proportions is very important. And I have to admit, I'm occasionally guilty of that. Limiting your processed foods and sugary foods and drinks is important. Lots of vegetables. Most people lump in fruits and vegetables, which fruits are very good for you. I'm not going to deny that. But they're also high, a lot of them are high in calories. So just watch it with the fruits. But vegetables, if you can increase your vegetables, that'll make a big difference. Plus it increases your fiber then, which is good for your gut health. So that's good. And just limiting the carbohydrates, I'm trying to find a certain brush and I'm not finding it. Here it is. Yeah, and I try to avoid processed foods too. I think we all eat too many processed foods because it's easy. I get it. Totally. But the more that we can eat that's fresh and closest to its natural point of origin, I guess you'd say, the better. And if you were able to, it does end up being a little bit more pricey, but if you can do organic, that's definitely better for you. There's a whole lot of garbage that's put into farming sometimes. And I get why the farmers do it because, you know, they're trying to make the most they can per acre. I get it. But unfortunately, we're harming our health by doing it. We don't want to do that. Just going to set my under eye a bit. I'm just doing simple makeup today for you. Now, something your doctor may go over with you or you can ask your doctor about is vitamins and supplements. I think for the average individual, if you want to just use a multivitamin, that's going to be okay. So if you don't check in with your doctor about that, I think that that's going to be fine. Follow the multivitamin instructions on there. Obviously, you don't want to take more than you should. And that goes for anything over the counter. You know, whether it's allergy medicine, cold medicine, whatever you get over the counter, make sure that you're following the package instructions. And warnings. Look at what those warnings are. Sometimes they'll tell you what medications you can't be taking with it and all of that. So multivitamin, I think, is good for anybody. Because quite often, if we're not eating a really good balanced diet, we're not getting all of the vitamins and minerals we should be. Now, your doctor can do blood tests and find out if you're deficient in any areas. And then you can take supplements to help replace those. So like me, I am vitamin D deficient. So I have been taking vitamin D supplement for a long time. And I actually just recently had my doctor's visit. And my vitamin D is doing well. So we'll just stay on that supplement. And things are good. Same thing with vitamin B12. I take a supplement of that because I am low on that. So that's, you know, kind of it on the supplements. And so I guess that's about it. Good hygiene, see a doctor, exercise, eat well. It's all things we've heard before. And I know it's easier said than done. Believe me, I know that. But it's better to try than not try. So don't get discouraged if you're doing well with your diet and everything for a while and then you slip off the wagon a couple times or whatever. It's okay. Just start being good again, you know, and it's the slow way to lose weight, but it'll be the way that's going to last the longest for you. All these fad diets and everything, they don't work. They work, you'll lose weight, but then you go back to eating normally and it all comes back. So you're better off trying to change your behaviors. And if that has to happen slowly, it has to happen slowly. If it has to happen quicker, you may need the help of a doctor or something to get you along. But, so yeah. What do I have left? Oh, I have mascara left. Oh, I didn't do an eyeliner. Oh my gosh. So, oh, I think I've talked to you guys about how I do my eyeliner since I have hooded eyes and a little bit of an eye droop. I do a tight lining technique. Some people go from above, which is fine. You can do it from above like that. I find it easier for me if I lift my lid up and just go along the lash line. So that's how I do my eyeliner. And then I'll bring it a little bit thicker. Oops. I done do a boo-boo. That's okay. And a little bit down here. So I do a little extra at the end of it. Right here. And then I use my angled lining brush to kind of smudge it along. And you can already see a difference between my lined eye and my unlined eye. So let me finish lining here. It's kind of hard doing it in a space I'm not used to. I'm in my craft room, which is where I do my videoing. So I bring my makeup in here. And do it in here. So how many of you out there, I did a little boo-boo there. Speaking of craft room, so this actually used to be one of my son's rooms, but he's grown and gone. So it is now my craft room. So it's kind of fun. It's one benefit of them flying the coop, although I do miss my boys. I miss doing things with them. We always had fun together. I'm going to put some lash primer on. I forgot my eyelash curler, so I'm not doing that. And to be honest, sometimes I don't do it every time anyway. Depends on how with it I am. And this mascara is and the primer is Marc Jacobs. I used Laura Mercier for my foundation, my primer, my my eyeshadow primer. Of course, I ended up getting mascara in my lower lid. I should really wait until this dries and get rid of it. That's best, because then you can just flick it away. But if you're in a hurry, you can try and swipe it away with, I sometimes use a Q-tip, and that's all because I'm just very impatient. So there you have it. And I just got 3 new lip glosses from Buxom. I've heard other YouTubers say how wonderful the Buxom glosses are. So I just got 3 new ones. I'm going to try this one first, except I can't open it. I think I have too much lotion on my hands. There we go. Just had to pop that open. Ooh, it's cool. And sometimes it all depends on whether I'm doing something that I want to look really good and last, or I don't really care. So sometimes I'll line and fill in my lips with a pencil if I'm going to just use a gloss, and then go with that. Sometimes I just put the gloss on, which is fine, right? I like it. It's not as sticky as Marc Jacobs. Marc Jacobs has a really good gloss, but I find it to be a little bit sticky. And this is not really. There's a little tingle to it because it's supposed to hydrate and plump you. So, and I'm going to do another little dusting of powder. You probably noticed that I did a light powder after I put my foundation on. Put another little dusting there. And then we have our setting spray. And my simple everyday makeup is on. Probably not the best makeup job I've done because I was talking and thinking at the same time. But not too bad. So I hope some of this information was informative to you. I'm sorry this video was a little bit long, but I really enjoy bringing some of the knowledge that I've learned over the years as a nurse and just as a person to you. And if you have any comments or concerns or whatever, post them below for me and I'll answer them the best I can. I hope you liked the video. If you did, give it a little thumbs up. And of course, I would love a subscription. And until next time, ciao Bella.